Here is the scenario. An intubated patient is on a continuous propofol infusion. Current RASS is -4. A travel nurse reports the patient failed the visual inattention test. The travel nurse plans to document a positive CAM-ICU. Two pieces to hold side by side. The observation. The patient did not attend to the visual stimulus, the planned action. Chart CAM-ICU positive. The observation is right. The conclusion is wrong. The colleague is making a gate error, not a tool error. Your four options. Option A, switch to ICDSC because it relies on observational data. Option B, document CAM-ICU as unable to assess due to depth of sedation. Option C, validate the positive CAM-ICU finding. Option D, initiate a spontaneous awakening trial first. Pause here, pick your answer. Ready? 3 answers either lock in an invalid finding or chase a different tool through the same closed gate. 1 names the gate honestly and waits for the right window. The correct answer is option B, document CAM-ICU as unable to assess. Why unable to assess? Picture the patient's mental state as a room behind a window. CAM-ICU is the method you use to look through the window. When the patient is awake, the curtains are open. You can see in. Now the propofol is running. RASS drops to -4. The patient does not respond to voice. Curtains close. You can stand at the window all day. You will not see what is happening in the room. CAM-ICU has a hard sedation gate. The protocol starts with a sedation check. RASS -4 or -5. Stop the assessment. Document unable to assess. Inattention requires the patient to attend to something first. The patient at RASS -4 attends to nothing because the patient is not arousable to voice. That is coma, not delirium. CAM-ICU was never designed to tell those apart. ICDSC has the same gate problem. Switching tools is just a different angle on the same closed window. The right move is plain. Document unable to assess. Plan the next window when the patient lightens. Sedation closes the window. Wake first, then look. The RASS gate. RASS +1 to +3. Restless to very agitated. Assessive safe. RASS 0. Alert and calm. Best window. RASS -1 to -3. Drowsy to moderate sedation. Valid if the patient opens eyes to voice. RASS -4. No response to voice. Stop. Unable to assess. RASS -5. No response to physical stimulation. Stop. Green band assess. Red band wait. 4 moves at the bedside. 1. Pause the documentation. Catch the chart entry before it posts. Frame as a gate question, not a competence question. 2. Show the RASS gate. Walk through the sedation check on the CAM-ICU pocket card. Plain language, 30 seconds. 3. Document unable to assess. Chart the RASS, the assessment attempt, and the gate-driven decision. Retest when the patient lightens. 4. Plan the next window. Coordinate with the team on the next sedation interruption or SAT trial. Reassess CAM-ICU then. Teaching the gate is the work. Why the others fail? Option A, switch to ICDSC. ICDSC is also validated and also relies on observable behaviors that need a baseline arousal. At RASS -4, both tools fail equally. Switching the tool does not open the window. Same closed view from a different angle. Closed window. Option C, validate the positive finding. Validating reinforces an invalid finding. Inattention is the expected feature of deep sedation. The test cannot tell you whether the inattention is from drug or from disease. Charting positive locks in a wrong answer in the medical record. Closed window. Option D, Spontaneous awakening trial first. An awakening trial is part of the bundle to reduce delirium long term. It is not the immediate fix for a documentation error happening right now. It may also be clinically contraindicated depending on the reason for sedation. Closed window. Closed window. Wake first, then look. If you want to pass CCRN the first time, PrepSolution has you covered. 1,200 clinical questions across all body systems, 3 full-length mock exams, 1,000 high-density flashcards, the Clinical Decision Masterclass, an adaptive 12-week study calendar. Thanks for watching. Practice every day. Pass with confidence. Please visit PrepSolution.com/exam/CCRN for more information.